Dr. Lavanya, consultant pediatric gastroenterologist and hepatologist from Rainbow Children's Hospital, Bangalore. On the eve of World Hepatitis Day, which is observed on 28th of July every year, I'm here to talk about viral hepatitis in children. The theme set by WHO for this year, World Hepatitis Day, is It's Time for Action, which means we should increase our awareness about this condition, diagnose this condition early, appropriate treatment and preventative measures. This is not a new condition. The word hepatitis in Greek means inflammation of the liver. This is a condition that was very well known to the ancient man, who actually thought that liver was the seat of the soul, not the heart or the brain, and many civilizations believed that jaundice was because of devil's work. So now we have come a long way with our understanding about this condition and the way we manage this condition. Hepatitis can happen due to a number of reasons, including infections like viral, bacterial pathogens, certain drugs, toxins, immune-mediated conditions and metabolic conditions. Here we are talking about viral hepatitis, which is commonly caused by 5 different viruses labeled as hepatitis A, hepatitis B, hepatitis C, hepatitis D and hepatitis E viruses. There are about 300 million people living in this world with chronic infection by hepatitis B and C viruses, and at least 3,000 people are dying every day because of these infections. This is the estimate by World Health Organization. Hence, it's very important for us to understand this condition and have a high degree of awareness. So let's look at hepatitis A. This is commonly spread from one person to the other by ingestion of contaminated food or water. These children present to us with fever, upper abdominal pain or right-sided abdominal pain, nausea, vomiting, just tiredness, very poor appetite and jaundice. Jaundice means the white of the eyes looking very yellow, urine looking very high yellow color, and sometimes stool looks pale colored. These children are more symptomatic if the infection happens when they are older than 6 years of age. Younger children have usually milder symptoms and recover quickly. Sometimes older children can go into complications like prolonged jaundice, which can last even for 2 to 3 months, and very rarely they can go in for severe liver damage, what is called acute liver failure, which may require liver transplantation. This viral infection can certainly be prevented by 1. Following strict hygiene measures, eating healthy food, and number 2, by administering a vaccine to children above 1 year of age, which is highly effective. Now looking at hepatitis E infection, which again most of the time it is spread by contaminated water, and the children who get these infections, usually healthy children, do not develop any symptoms, whereas those who have compromise in their immune condition can develop again similar symptoms just like hepatitis A, with fever, abdominal pain, nausea, vomiting, with or without jaundice. And pregnant mothers are particularly at high risk during the second half of pregnancy. They can transmit the infection to the newborn child also. Hepatitis B, hepatitis C, hepatitis D are all transmitted by injection of contaminated blood or use of organs that are contaminated with the virus that have been infected, or by use of needles that have been contaminated. Hence, it is very important to pay attention to these little things. And also, safe sexual practices is very important among adolescents and adults. And in children, majority of the infection is acquired from the mother during pregnancy, from an infected mother, or during childbirth, as in hepatitis B. So how do we prevent this? 1, by safe injection practices, use of blood and organs that have been thoroughly screened for infection, safe sexual practices. And in the case of hepatitis B, there is a very effective vaccine available, which is given to all children within 12 hours of their birth. And babies who have been born to mothers who already have the infection, they are also given immunoglobulin, which is a special medicine that will help babies avoid getting the risk of infection. Most of these babies who get infection from the mother, what we call perinatal transmission, they tend to develop chronic infection, which means it lasts for years, and 90% of them will go into develop chronic infection. A very small number, less than 5%, can develop chronic liver damage, what is called cirrhosis, ultimately leading to liver failure and need for transplant. And a very small number can also develop cancer of the liver at any age, more so as they grow older. So it is important for us to identify these infections and prevent them from happening. Hepatitis D usually tags along with another virus and causes similar problems. So following on with the WHO theme for this year, let's take the necessary steps to get rid of chronic viral hepatitis from this world by 2030, which is the target for WHO. Thank you.